仅仅在数周时间之内，从中国武汉爆发的新型冠状病毒疾病从原因的不明原因肺炎变成了全球人见人怕的疫情。世界各地的人们对病毒展开了一场全球性的防疫战争。随着疫情继续在世界范围内蔓延，而且带来恐慌，科学家们正在努力开发出应对的治疗方法。针对新型的冠状病毒，我们有什么需要了解的呢？来看，这是来自亨廷顿医院疾病与预防控制中心主任为我们来做的具体解答。
Hi, my name's Leonard De La Cruz. I'm the Director of Infection Prevention and Control at Huntington Hospital. There's a lot of concern about coronavirus. It is understandable because we do not know a lot about coronavirus. It is important to note, though, that there's a lot of information that we've already gathered. So we have to focus on what we know rather than what we do not know. Let me just clarify that the novel strain of coronavirus is different from the normal coronaviruses that we see on a seasonal basis. There are actually 4 human coronaviruses that we see during the flu and cold season. The flu virus comes from a different family than the coronaviruses. However, they're both what we call envelope viruses. Envelope viruses are easy to kill with common disinfectants and alcohol, so feel free to sanitize your hands with alcohol. The biggest difference between the flu and the coronavirus is that we have a vaccine available for the flu, so it's important to get vaccinated for the flu. The coronavirus, however, does not have a vaccine available. The best information that we have on coronavirus is the investigations of the 2003 outbreak of SARS coronavirus. During this outbreak of SARS coronavirus, we found that the coronavirus is transmitted via droplets. A droplet basically is a fluid formed through coughing or sneezing. These droplets travel to about 6 feet, then drop to the ground. Knowing that information, the best way to prevent an infection from the coronavirus is to stay away from sick people. Also, if you are sick, stay home. If you are around sick people, or if you have to take care of sick family members, wash your hands often. Do not touch your eyes, your nose, or your mouth without washing your hands, and cover your cough and sneeze. There are 2 things to consider. Number 1, there is a high demand for masks globally, and resources are limited. Number 2, masks can help prevent infections, but it is not the best way to prevent infections. Here in the US, unless you are in close contact with a person with coronavirus, the risk of contracting coronavirus is very low. The best way to prevent infections is to practice good hand hygiene and respiratory hygiene instead of wearing a mask. From what we know currently, the signs and symptoms of coronavirus infection are fever, cough, or shortness of breath. If you think you have coronavirus and you have traveled to areas affected by the current outbreak, please contact the health department. If you need to go to an emergency department, please contact the emergency department beforehand. The data and information regarding coronavirus are always changing. It is important to get updated with factual information. You have resources through the CDC, the World Health Organization, or your local health department.